Yeah, we are live.
Okay. So shall I start with the event now?
Yes, Shanvi.
Okay. Good evening, everyone. On behalf of Garla Ramanujan, I would like to extend my warm welcome to everyone who is present here today. As B.J. Palmer once said, the preservation of health is easier than the cure of the disease. Today, we have gathered here to discuss the important topic of preventative health talk for youngsters. During this session, we will learn about the significance of early detection and prevention of conditions such as breast and cervical cancer and menstrual irregularities like PCOD in young women. I would like to welcome our guest speaker, Dr. Nitika Garg, who has accepted our invitation and graced her with her presence today. A very good evening to you, ma'am.
Thank you. Good evening.
I would also like to extend a warm welcome to our conveners, Umisha ma'am and Rose ma'am. Good evening to you, teachers. Our speaker, Dr. Garg, is a highly respected obstetrician and gynecologist surgeon practicing in Aligarh and is also a laparoscopic and a fertility specialist. She is currently working at the Shivam Care Center and Hospital in Aligarh and has a wealth of knowledge and experience in treating major and minor gynecology and obstetrics diseases. Dr. Garg is a gold medalist in MBBS and completed her MD from LLRM Meerut, where she was awarded the Best PG Student. She is the treasurer of the Stillbirth Society of India and an active member of the Federation of Obstetric and Gynecological Societies of India. She has participated in various camps for prevention against breast and cervical cancer. She has delivered talks on adolescent health and hygiene on FM and the All India Radio. She has been regularly featured in the newspaper and other platforms to educate the public about women's health. With over 20 years of experience in the field, Dr. Nitika Garg has dedicated her career to improving women's health and raising awareness about these conditions. I'm thrilled to have us here with us today. I will now request Dr. Garg to begin with this session. Any questions that our audience wants answered can be put in the chat box. These will be addressed at the end of the session. Over to you, ma'am.
Okay, thank you, Janvi, for your kind introduction. So, respected faculty members and my dear youngsters, it's a very bright, cheerful, and warm evening to each one of you. I am Dr. Nitika, and I'm really glad to be given an opportunity to talk in front of you. Today, I am here to discuss various health problems that youngsters encounter in day-to-day life. As you all know that cervical carcinoma is the second most common cancer amongst women in India. The first is breast cancer. So what is cervical cancer? Bachedani uterus ke muh ka cancer. And it is second commonest. So I would like to speak few lines about it. You should all know the 10 warning signs of start of the cervical cancer. That is unusual vaginal discharge, abnormal vaginal bleeding, heavier and longer menstrual cycle or intermenstrual bleeding, irregular menses, discomfort while urinating, loss of bladder control, pain during intercourse, constant fatigue, which cannot be explained by anything, pelvic pain, unexplained weight loss, and leg pains. Now let us come to the risk factors of the carcinoma, that is cancer. As COVID also came by a virus, so this also comes by human papilloma virus. So its etiology also lies in a virus. Then few predisposing factors like early marriage, sexually active at a young age, having multiple sexual partners, poor genital hygiene, smoking, multiple pregnancies, and weakened immune system, use of irrational use of OCPs, all these are great risk factors. But there are good news also for everyone. Now there are vaccines available for the prevention. We have got 3 kinds of vaccines: Cervarix, Gardasil 9, which is newly introduced. They cover lots of the genes of the human papilloma virus. It can be given between the age of 9 to 45 years. But the initial age, 9 to 26 years, is the most preferable age in which the vaccination should be completed. And one good thing is that even males should be vaccinated. Their anal and penile cancers can be prevented. So it is good for both males and females. Am I audible clearly?
Yes,
Yes,
ma'am.
Okay. Now there are screening methods available which can detect the cells on your cervix, which can be called as bad cells, suspicious cells, which can lead to cancer in almost 10 to 15 years later. So we can go for liquid-based cytology, human papilloma virus infection, or pap smear in simple words. They can be done by a doctor if you approach her. What is pap smear? It just analyzes cells from the cervix. It gives early detection of cancerous cells. It detects the precancerous cells. So if they are detected, then we can plan the treatment accordingly. So here we are. Get informed, get screened, get vaccinated. So this is the time when all the youngsters should approach their nearby gynecologist, get themselves vaccinated, and definitely win over this problem. Now, the next thing I would like to highlight is this is a case study. Miss X, 22 years, unmarried female, came in the OPD with history of lower abdominal pain with menstrual irregularities. On examination, the doctor finds a lump palpable in the lower abdomen, which is almost equivalent to 16 weeks of pregnancy. On ultrasound, it came out to be an ovarian mass. So I would like to tell you various things about these ovarian masses, which has become so common in youngsters. We females have got two ovaries, one on each side of the uterus. One is this and another one is this one. So you see the unilateral ovary is enlarged. It is filled with fluid. The symptoms of this ovarian cyst is the most important is lower abdominal pain, cramping, bloating, lower back pain, breathlessness if it increases to a big size. Then the patient can come with nausea, vomiting, loss of appetite, unexplained weight loss and exhaustion, fatigue, a quick feeling of satiety on eating. So if any of these symptoms trouble you, do consult a gynecologist nearby so that the cyst does not increase to a size where we have to operate. There is no hormone left with us to cure these cysts. So better you come fast to a doctor, tell your problem and get yourself cured. Another case study is regarding breast lumps. Miss Z, 20 years, unmarried female, comes with complaint of a breast lump, which she noticed a day before. It is painless, so she came in the OPD for expert opinion. Examination of the breast revealed a 3 into 2 centimeter lump in the upper outer quadrant of the left breast. An ultrasound was done of the breast, which revealed fibroadenoma breast. Do you all know that breast fibroadenoma is one of the commonest benign tumors of the breast? Every lump is not a cancer, so please don't be afraid. If you find even a small lump in your breast, the only symptom you see either a lump, it is firm, round, smooth, rubbery, movable, and it is hardly painful. But sometimes you feel pain right before the periods. Treatment options depend on fibroadenoma type, symptoms, and individual's emotional state. Causes are quite unknown. But here comes the importance of breast self-examination. Everybody should examine her breast, look in the mirror, visually inspect with the arms in different positions, like the hands up, hands by the side, hands resting on the waist or the back. And now gently use the pads, this part, gently use the pads of your fingertips. and just go in a systematic manner, in a clock pattern. And if you find even a small swelling or lump, which is very much different from the normal lumpy feel of the breast, definitely consult a nearby female doctor or physician, whichever, whomever you feel to be convenient to go to. Now, let us come to another very common case scenario. I hope you people are understanding what I mean to say. Another case problem, Miss X, 17 years old, who has attained menarche at 13 years of age, comes to my OPD with complaints of acne, weight gain, and delayed menstrual cycles. The basic BMI of 26.5. Now, I have to come to a diagnosis, how to manage her, how to give a treatment protocol, and the main part comes of the counseling. The most common cause of menstrual irregularities like delayed menses, weight gain, acne, it is polycystic ovarian syndrome, which we see in at least 1 in 10 females of your age. The symptoms are abnormal uterine bleeding, weight gain, acne, facial hair growth, and which all these things lead to depression, stress, and anxiety in the youngsters. And when they get married, it may lead to repeated miscarriages and infertility. So, here comes the importance of management right from the adolescent age. They have to go for a very nutritious food, go for some exercise schedule like walking, swimming, yoga, which can reduce their weight, avoid carbs, avoid oily and fried food, market food, and then eat plenty of green leafy vegetables, steamed, boiled food, etc. Do you know when your periods are called to be irregular? If they are between 21 to 35 days, it is a normal cycle. But if they are frequently coming less than 21 days or delayed of more than 35 days, then they are called to be irregular. And the causes of menstrual disorders are hormonal imbalance, which is very common, LH, FSH, estradiol, all these hormones, thyroid especially. If you are gaining weight, then definitely thyroid hormone is also to be evaluated. Then there are various stress and lifestyle related factors, irrational use of birth control pills, and definitely polycystic ovary syndrome, in which the ovaries get enlarged. There are lots of immature follicles inside. Not even a single follicle matures and ovulates, and these becomes anovulatory cycles. So it is an endocrine and metabolic disorder that is increasing day by day, and we find it very frequently amongst the youngsters. Now the question is, how should we prevent menstrual disorders? So here are a few tips. Medicines definitely that can be given only by your doctor. Drink plenty of fluids, especially water. If you have dysmenorrhea, pain during menses, or any menstrual problems, you can give hot fomentation to your lower abdomen. Get healthy food for you. Even in hostels, you can get healthy food if you just pay attention. A regular exercise or yoga schedule, Zumba, dance, anything what makes you good, feel good. And herbal tea or green tea also is good enough. Now, lastly, I would come to sexual health. The World Health Organization defines sexual health as a state of physical, mental, and social well being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. This is what it takes for me to be sexually healthy. I am comfortable with my body and my sexuality. I can talk effectively with my peers, family, and partners. I know my body and how it functions. I understand the risks, responsibilities, and consequences of sexual behavior. I am able to recognize risks and ways to reduce them. I know how to access and use healthcare services and information. I am able to set boundaries when it comes to sex and sexual relationships. I act responsibly according to my personal values. I am able to form and maintain healthy relationships. So, girls, thank you for your kind attention and calling me over here. So, a few pearls of wisdom in the end. Keep learning, be curious, work hard, be honest, have fun, stop listening to naysayers, keep good friends. That's all. Thank you very much. Any questions? I will be happy to solve your problems. For online consultation, I'm always there for you. Contact on this number 7351 426939. Thank you very much.
Thank you so much, ma'am. So we have some questions that our audience wants answered. So पहला question है कि somebody has put up the question: is there a relationship between diabetes and breast cancer or cervical cancer or PCOD? Diabetes के साथ कोई relationship है क्या?
Yes, hair. Like PCOD in young age often leads to type 2 diabetes mellitus in old age. So PCO patients always they should reduce their weight. Then they should have a healthy lifestyle, follow exercises, pay heed to their weight definitely, and their blood sugar monitoring should continue later in life. And if they develop diabetes, then definitely regular checkups by a doctor. Breast cancer, only very less increase along with diabetes. But if diabetes is present in a lady, then definitely these things, breast cancer, cervical carcinoma, their recovery is delayed. And definitely a small risk is also associated. But carcinoma of the endometrium, like cancer of the inner lining of the uterus, is definitely associated with diabetes, obesity, and hypertension. If a lady has diabetes, blood pressure high, and she is obese, then she has definite fold increase in the incidence of endometrial carcinoma, that is uterus की lining का cancer.
Okay. Thank you so much, ma'am. Ma'am, अगला question है, what measures can we take to maintain a healthy lifestyle in order to prevent breast cancer or cervical cancer or PCOD?
I think I have answered in my slides. It is just a repetition that for breast carcinoma, even the slightest, smallest lump, you should self-examine and come to the doctor as soon as possible. Then irrational use of OCPs should not be there. Estrogen, unopposed estrogen, that is also should not be taken by youngsters. And when they are going for various abortion pills and unhealthy sex, multiple sexual partners, and starting sexual life at a young age, all these things they should pay heed to, because these things, they will lead to cervical carcinoma in older age. Cervical screening methods that I told, like pap smear, liquid-based cytology, they should be done every 3 years, starting from 21 years. And the vaccination that has come for prevention. Cervical carcinoma vaccine, I would like to elaborate. These vaccines are given in 3 doses, 0, 2, and 6 months. Like first time you give today, then after 2 months, then after 6 months. So there are 3 doses. The much used one is Gardasil vaccine, which prevents against warts as well as cervical carcinoma. So it costs around 3,800 per dose, and 0 to 6 is the schedule. Now the newly introduced is Gardasil 9. So by MSD company, it is a bit more costly, like 8,500 per dose, given in 3 doses. And if it's given between 9 to 14 years, then only 2 doses are required, 0 and 6 months. So it is better if you all get your sisters or brothers or your young girls vaccinated in this age group, 9 to 14 years. So then it's good. And PCOD, definitely, if you see any girl gaining weight, then definitely you should pay heed right from the adolescence. Don't promote too many of paranthas, puri, chole bhature, market food. And sometimes the mothers are so busy, they give Maggie, pasta in the tiffins of young kids. So I think one should see that these things should be avoided, I think. So PCO can be prevented. And breast carcinoma, I think unopposed estrogen works a lot in breast carcinoma. So one should not take inappropriate use of estrogen hormone should not be taken. And definitely avoid obesity. Obesity is the, I think, की होल की सब बीमारियां बस इसके बाद ही बढ़ती हैं. लिपिड प्रोफाइल बढ़ जाता है, हार्ट प्रॉब्लम्स बहुत कॉमन है पीसीओडी में, बाद में चल के हार्ट में भी कार्डियोवेस्कुलर रिस्क बहुत बढ़ जाता है. तो नॉट ओनली डायबिटीज बट वन विल एंड अप इनटू मेनी थिंग्स.
ओके मैम, ओके मैम. ऑल्सो मैम, आपने अपने इसमें प्रेजेंटेशन में कई बार इरेशनल यूज ऑफ बर्थ कंट्रोल पिल्स का मेंशन किया. तो मैम, इरेशनल यूज और रैशनल यूज में क्या क्या आता है, आप उस पर थोड़ा एलैबोरेट कर सकती हैं?
Yes. Like my very close relative, she stays in US. So there the youngsters are regularly taking OCPs in college life, regularly before their marriages. So just to prevent, just as a contraception. So they take it for years together without knowing what harm it can cause. Okay. And the rational use is if a doctor prescribes for 3 to 6 cycles or maximum 1 year, then they go for regular checkups, go for one ultrasound because it can lead to gallbladder stones, deranged lipid profile, and many other things. So this is the rational and not irrational use. And our society is getting westernized very early. They are copying the West and taking all such things now. The college girls too.
Okay, ma'am. Ma'am, I guess these were the questions. Thank you so much, ma'am. It was such an informative session. Also, if anybody has any questions, so they can ask right now. Ma'am, I guess these were the questions. So thank you so much, ma'am. It was such an informative session. I personally learned a lot, many things, and that I was not already aware of. And I'm sure the audience did too. We are immensely grateful to you for lending us your valuable time. I would now request our convener, Ms. Umisha ma'am, to give a vote of thanks to Dr. Garg.
Thank you, Janvi. So first of all, as a part of my vote of thanks, I would like to start by extending my heartfelt gratitude to our principal sir, who could not join us today for some reason. Am I audible?
Yes, very much.
Sorry. Yeah. So, yes, our principal, Professor S.P. Agarwal of Ramanujan College, for his constant support, and he's very kind to us whenever we, propose any ideas. I would like to thank Dr. Nitika Garg, our speaker of the day, for taking out time and giving such an informative session. I think there are a lot of things that even I was personally trying to convey to our college girls, but coming from a professional, a doctor, it would make much more sense. So that is what we wanted, and I think we were somehow able to do that. A big thanks to our organizing team, starting with Ms. Rose Topno, our co-convener of Girl Up Ramanujan, all the co-team members, Neha, Samiksha, Prabhat, Debangna, Hemal. Special thanks to Janvi for connecting us with Dr. Nitika and all the volunteers of Girl Up Ramanujan who were involved. Thank you, Ravinder ji, for helping us with the Zoom. And last but not the least, thank you to all the attendees who joined us today and made this event a success. Thank you.
Thank you very much. I was also very happy to convey all what I wish to, and many things are still left, but
Yeah.
thank you so much.
Thank you so much, ma'am. Neha, अपने side से just make sure that you're ending the meeting and stopping the live recording just before you do
Yes,
that.
ma'am. Thank you, ma'am, for such an informative session.
Thank you, ma'am. And we'll try to connect with you again.
Yes.
Hopefully, we can conduct other sessions with you, and we can plan on other areas which are important for college going girls and even for school going if we can somehow tap on that audience.
Okay, okay. Thank you. Shall I leave now?
Yes, ma'am. Thank you.
Thank you. Nice talking to all of you.
Same here, ma'am.
Same here, ma'am.
Okay.
All right. Thank you, team, everyone. Have a good weekend. Thank you, everyone.
Thank you all.
Thank you, ma'am.
Thank you, ma'am.